Thank you, that's much better. Yes, for the shop people, you gotta lock it down. My name is Jenn Coffey, and I am a former Republican state representative here in the great state of New Hampshire.
We welcome you.
Thank you. Yes, I've learned a lot. I'm also the leader with Rights and Democracy New Hampshire. I'm here with you today to talk about our healthcare system. Between the healthcare system we have and the one we deserve. I was a healthcare worker for 20 years before cancer ended my career. I spent my life caring for others, working to save lives, answering 911 calls. I developed CRPS, complex regional pain syndrome. It's the most painful disease known to medicine. It's known as the suicide disease. 70% of people with it, young and old, will consider suicide, and they shouldn't have to. But treatments exist, and insurance companies refuse to cover them. The severe small fiber neuropathy that came with the CRPS has destroyed so many of my nerves that I'm not supposed to be able to stand here with you today. But I am standing here on the shoulders of the giants who marched so we can rise. When I was diagnosed, I had United Healthcare Medicare Advantage, a privatized Medicare plan. They refused to pay for the care that I needed to live. I had to sell everything, even my car. I had to have fundraisers and lose every shred of my dignity. At the same time, United Health shareholders were making more money by denying medical care to millions. Well, I sold my belongings, they bought more yachts and private jets. They don't fly with the peasants. I begged United Healthcare to grant me access to the care I needed. I joined with 100 other people, and I went to Minnesota, protested in their lobby. I told them, I don't want to die. While surrounded by others who were saying the exact same thing. I went to Washington, D.C. when United Health Group's CEO, Sir Andrew Whitty, was testifying in front of Congress. I asked him to listen to us, his members, to help us. He turned his back and walked away from the sick and the dying. Walk away from a 25-year-old woman given 5 years to live without a surgery United Healthcare refused to cover. John Lewis said healthcare is a right. Healthcare should not depend on the size of your wallet or the digits in your zip code. But healthcare today is often for the rich, supplied by the working class who can't even access the same care that they give.
Amen.
Now I get ads offering me no interest and low interest payment plans for the medications that keep me alive. This is America. Millions of people have lost their health insurance. Millions more are choosing between food and medicine. This is not what healthcare should look like in the United States. We deserve and could have so much more. I know that millions of people identify with my story, either because of their own experience or they watch somebody they love suffer. Now is the time to stand up. Now is the time to end the grotesque riches made by the elite on the backs of every one of us. Congressman Lewis said, if you see something that is not right, not fair, not just, you have a moral obligation. You have a mission to do something. So let's do something.